Hi there, my name is Dr. Hilary Booth and I'm a naturopathic doctor practicing in Toronto, Canada. Today I'm really excited to be a guest vlogger on the site, which is a fantastic resource for those of you who are looking to improve your health. Today I'm going to be speaking about a really serious and intimate topic of breast cancer. And as we well know, it's something that affects many people across the world. And there are things though that you can do to help reduce your risk of developing breast cancer. So I want to start out with a little bit of information. 1 in 10 of all new cancers diagnosed each year is breast cancer, and it's the most common cancer in women in both developing countries and in developed countries, and it accounts for 30% of all cancers in North America. It is the most common cause of cancer death among women, and it accounts for 20% of all cancer-related deaths. So of course we want to do as much as we possibly can to prevent breast cancer, especially if you are at risk. So I'm going to be listing off a lot of some of the risks that go into when your doctor looks and sees whether or not you have a higher risk for developing breast cancer. But by no means are these a complete list. By no means do these mean that you will get breast cancer or you won't get breast cancer depending on having these risks. But I want you to listen to this list, and if you are checking off a lot of these boxes, you may want to consider being more diligent about your breast health. So the risks are having no children, or having children after the age of 30 years of age, or not breastfeeding, lacking of exercise, having fewer than 2 bowel movements per week, being more than 154 pounds or over 5'6", and having a BMI of over 28. Now in Canada, which is where I practice, a BMI of over 28 is considered overweight, but in America, a BMI of 28 is not considered overweight. So that's something to really think about. About what your BMI actually is and whether or not that's affecting your health, regardless of what category you might fall into. Other risk factors include having a mother or sister with breast cancer, or any relative with ovarian cancer or endometrial cancer, or a brother or a father with prostate cancer. These are all genetically related, and you can get genetic testing if you do have a family member with one of these cancers. If you're fair-skinned like me, if you have allergies or chronic inflammation, if you have a history of strep throat, of mono, of HPV, that's genital warts, or of antibiotic use. If you have hypothyroidism, if you have more than 3 drinks per week, if you dye your hair, if you have dental issues, if you've had root canals or mercury fillings, if you wear tight bras, if you sleep with any light in your room at night, or if you do shift work, if you are taking the birth control pill before the age of 20 or for more than 5 years after the age of 35. These are all things that put you at slightly higher risk of having breast cancer. Of course, some of these more than others. So what are my top 6 tips for how do we go about preventing breast cancer? Tip number 1 is doing self-breast exams. Here in Canada, doctors do not do them anymore, and they also advise against self-breast exams. I am of the camp that I am against this advisory. They advise against it because they don't want to create alarm and panic, because often people will have undue anxiety from finding abnormalities in their breasts. But I think this is a matter of education, not of an actual proper health measure. So we're going to learn how to do self-breast exams, and it's quite simple. So first of all, you want to do them at the same time every month. So for example, you might pick Friday mornings for the first Friday of every month. You may want to do them at the same time every week, and that's fine, but you do need to recognize that your breasts will go through normal and natural changes and rhythms with your menstrual cycle. So, for example, as your menstrual cycle changes, you will notice that there may be some more what we call fibrocystic areas of the breast, where you're feeling something like a little, almost like the tip of your nose, or a little pea under the skin and in the tissue of the breast, or what we call sort of the fibro part of fibrocystic breasts, which are more fibrous tissues. It feels a little bit ropey underneath the skin, and this is completely normal. And if it is normal, you should see it ebb and flow and change throughout your cycle. So if you feel a mass that does not change with your cycle, that means it stays the same for an entire month, and it's hard like a rock, and it is not movable, meaning you can't put it under your fingers and kind of roll it around underneath the skin, or if it is growing significantly over time, you need to have this checked out by your healthcare provider. You should also take your time while doing self-breast exams. It should take 2 to 5 minutes per breast. You should ensure that you're feeling right up into the armpit, right up to the collarbone, right across to the center of the chest, and all the way down, much further than you'd think. Actually, you're going to want to go all the way down to the lower rib cage, because the breast tissue under the skin is actually a larger area than maybe what you might consider your breast. Really make sure that you are pressing in a superficial level, a middle level, and then a deep level. It's important to feel all 3 levels underneath the tissue, especially in the more denser breast tissue areas. And lastly, it's really important to keep a journal of the dates and the times in which you performed the exams and whether or not you felt anything. You may have felt a little bit of that, like the tip of your nose under the skin, something that's movable, something that maybe feels like a little bit of a fiber under the skin, and that's normal. And you just want to track those changes month to month, in order to sort of get an idea of what's normal for your body and what might and eventually possibly grow and be abnormal, which is what you want to talk to your doctor about. The second thing I want to encourage you to do to prevent breast cancer is change your diet. You want to be getting at least 45 grams of fiber in a day. This means you're getting it from legumes like beans and veggies, especially those fibrous ones like spinach and kale. Chia and hemp hearts and flax are all great ways of increasing your fiber. You want to reduce your intake of red meats, of dairy, of processed foods, and sugar. Instead, you're having fresh, free-range, grass-fed organic meats like chicken, and then you're having lots of things like beans and lentils and chickpeas and quinoa and nuts and seeds in order to get your protein. Include 2 tablespoons of freshly ground flax seeds per day. You can put those on your smoothie or on your salad. You want to grind it yourself about 2 to 5 days at a time. Keep it in your fridge in a sealed container and use that. And then you can enjoy things like miso soup, tofu, and tempeh at least once per week, because they have estrogen modulating effects, which can actually be protective for breast cancer. My tip number 3 is to get adequate vitamin D. So research shows that this is preventative for many types of cancer, including breast cancer. 15 minutes of exposure daily during the peak hours of sunlight on the arms and legs without sunscreen gives you your adequate amount. Or you can take 2,000 to 4,000 IUs per day in a liquid soluble form in a fat soluble carrier, because vitamin D is a fat soluble vitamin. So you want to be taking it with foods in a fat soluble carrier, not as a tablet or a pill. Studies show that this adequate amount of vitamin D reduces death from breast cancer by 50%, and approximately 58,000 new breast cancer cases per year would be reduced if people had adequate vitamin D levels. I would also encourage you to go on the Zite website and look for more ways that you can get outside, and so you can get that natural vitamin D intake from doing great outdoor activities. Number 4 tip I have for you is to do a detox once per year. That's all it takes. Talk to your naturopathic doctor about what kind of detox is right for you, because there's many different kinds. You can do a liver cleanse, a colon cleanse, a lymph drainage cleanse, maybe a heavy metal cleanse, or a candida cleanse, depending on what's going on for you. You always want to talk to a health professional to make sure it's safe and effective. Tip number 5 is to exercise for 40 minutes per day or 4 hours total per week. Again, research on this is really, really shocking. It shows that this is preventative for lots of different cancers, not just breast cancer, but it does reduce the risk of breast cancer by 30 to 40%. Exercise is important for all the reasons we typically think about, but I want to share with you another reason why exercise might be effective in a different way that you hadn't learned before. So your lymph is a different system in your body that carries your fats, your proteins, and your immune soldiers around your body. Now, our lymph system doesn't have a heart the same way our blood system does. So our heart pumps our circulatory system around, but our lymph system doesn't have that. So when we exercise, we actually are contracting our muscles, and it's these muscle contractions that push the lymph circulation around your body. So when we are pushing these lymph circulations around our body, it's actually protective and preventative for breast cancers, because this lymph drainage is extremely important for cancer prevention. There are many, many lymph tissues and lymph nodes around the breast tissue, all the way up through into the armpit, as we discussed before, all the way across the collarbone, all the way down the sternum, and again across underneath the breast tissue. So it's really important to get moving in order to move this lymph around. My final 6th tip for you is to avoid xenoestrogens. So xenoestrogens are synthetic chemicals that are found in in plastics and pesticides, and our body sees them as estrogen. So when we build up these things in the body, our body actually shows symptoms of having excess or really high estrogen levels. And excess estrogen is a major risk factor for developing breast cancer. So how do we do this? This means no plastic water bottles whatsoever, no plastic Tupperware. You're using stainless steel and glass. Nothing hot in plastic. This includes takeout containers and again Tupperware containers. None of these should be used to store food. You're eating organic, hormone-free meats and produce whenever you can, and you're switching to non-toxic cleaning products. You can use baking soda, you can use vinegar for lots and lots of non-toxic cleaning methods in your household. Look them up online. There are tons of really great resources for you there. You're avoiding products that have things like phthalates and fragrances in them, because these ones can actually mimic estrogen in the body, and you're avoiding products with chlorine. So as a recap for you today, my top 6 tips. Number 1 is doing self-breast exams regularly and knowing what's normal and what's not. Number 2 is changing your diet, having lots of fiber and lots of flax and 1 serving of soy per week. Number 3 is getting adequate vitamin D. Number 4 is doing a detox once per year. Number 5 is exercising for 4 hours per week. We're getting our lymphatic drainage going as part of something beneficial that exercise does for us. And number 6 is to avoid xenoestrogens. Those are those sources of estrogen outside the body that mimic estrogen inside the body and increase our risk of breast cancer. So I really want to thank Desight for having me this week. If you have any questions, please leave them in the comments section below. Again, my name is Dr. Hilary Booth, and I practice in downtown Toronto. My clinic website is darouwellness.com. That's DAROUWELLNESS.com. I'm happy to accept new patients or accept any questions that you might have for me there. I do also offer free health seminars, so if you're in the area, please inquire about that, and I would be happy to come and do free health seminars for you. That's everything from me. Have a wonderful week, everybody. Thanks for watching.